but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects. Provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services. Elite Home Health Services is a CHAP accredited and Medicare certified home health care agency that is owned and operated solely by registered nurses, all with advanced skills and extensive experience in home health care. Call us at 888-422-3578. Our team of caring professionals include registered nurses, licensed professional nurses, registered physical, speech, and occupational therapists, medical social workers, and certified nursing assistants. Visit our website at elitehomehealth.com. All employees are subject to detailed background and reference checks. Their team-oriented approach ensures an optimal outcome for all of our patients. For more information, call us at 888-422-3578.
Good evening, everybody, and welcome to Elite Home Healthcare, sponsoring Ketsia Lavaseur from a new premium caregiving service that I cannot wait to get into. And I'm here with Lisa Acosta from Elite Home Health. And I think this is the first show that we're doing from the new year, right?
Yes.
Well, happy 2020, everybody.
Yes.
And what a better way to bring in the new year with healthcare professionals, because I know there are going to be so many people out there that maybe ate too much, did a little too much drinking, and too many activities that weren't in the norm for them, and they're not feeling their best. So I'm so glad that we're starting off the new year talking about our healthcare professionals. And of course, thank you for supporting Elite Home Health. We only provide you guys with the best of the best. And of course, if you guys have any questions, please feel free to call in at 888-565-1470. We are here to answer all your questions for the next hour. So Lisa Acosta,
Yes.
tell me about your partnership with Elite Home Health.
Well, first off, Happy New Year.
Happy New
I'm excited
Year.
about 2020. And so we are a Medicare home health agency.
Mm-hmm.
I am an account manager. So on a daily basis, I'm out in the community marketing to our physicians, hospital case managers.
Amazing.
Yes, nursing homes. And we are owned and operated by registered nurses. Love my bosses. We have an awesome team of caring professionals. We have nurses, speech therapists, physical therapists, occupational therapists, social workers, and certified nursing assistants.
That's amazing. And you know, every other show that I do and the viewers see and hear Jackie speaking, Jackie's not here tonight, Lisa is filling in from her, but it's always so great to get another voice from the company. And from everybody that I've met that's worked with Elite Home Health, everyone's super happy. And everyone says they love their job.
Yes.
And they love bringing other people on here to advertise their business just to help the community. I think that that's something that you guys have all emphasized to me and to the viewers, and probably to your patients and everything. Everything is about the care for the community and your patients.
Absolutely.
I think that that's remarkable. I mean, you see so many cases and everything. People every day deal with doctors who are in and out and quick and fast, but you know, I know Ketsia also focuses on care as well. And I want to move into more with your guys' partnership. I like how you guys both do the transition care when a patient is coming home from the hospital, a procedure, anything that's happening. But, you know, obviously no competition.
Right.
We're all here together as a partner. And Ketsia, tell me a little bit about yourself.
Sure. Hi. I do want to take the time to say thank you to Elite Home Health for giving me the opportunity to use this platform today.
Oh, well, thank you for supporting
Thank
Elite
you
Home
very
Health.
much
welcome.
to
It's our
promote my
pleasure.
business. So what I do is geriatric care management. And of course, many people are not aware of what care management is. So
Right.
today I think we're going to use some of that time to provide a little bit of education to everybody out there.
So good.
So that they are aware of services and how it can benefit our elderly population.
Absolutely.
Because it's a very much needed area in healthcare that many people are not focusing too much on. So today we will take the opportunity to provide a little bit of education.
I'm so excited. And Lisa, with Elite Home Health, you guys take a variety of different patients. Tell me a little bit about the patients that you guys take in, because I know Ketsia is focused a little bit more on the elderly.
Right.
Correct.
So ours are Medicare. So typically age over 65 years old.
Okay. Wonderful. All right.
I think the difference between Elite Home Health and Premier Concierge Care Management is that typically they are of Medicare age, but the difference is that Medicare does pay for home health, but unfortunately at this point in time, we are not seeing any type of insurances that do cover for care management services.
Wow.
That's where we are able to work together
Okay.
and be that type of support in the community, because patients come home, they need Medicare home health, and then what happens when that's done? Because
Right.
it's not something that is ongoing. So then I think later on we'll get a little bit more into what Premier Concierge Care Management can do for patients after home health is done, because again, we understand for insurance purposes, this is how it works.
Right.
Absolutely. And that's why you guys make such a great pair, because your whole message is it's not about the patient in the operating room. It's not about the patient in the hospital, whatever the patient's going through. You can't just one-minded. It's not just them within the 15 minutes that you're seeing them. They have a life, and there's a reason that they're reoccurring in these offices, and there is a reason why they're dealing with these symptoms of whatever it may be that people are dealing with. I say, especially after the holidays, I know myself and my whole family, we're all staying up a lot later, germs, we're all touching everything, and there's kids around, and I know I'm not the only one, and it's hard when you're an elderly person and when you're a child, because
Correct.
you're losing your immune system almost. And I know my grandparents don't like to admit it because they lived a full, beautiful life, and they almost feel like it's a little, they don't need the help and they want to push it away. But that's what attracted me so much to Elite Home Health, because, they don't treat you like a patient. You're someone that they care about. And especially with the transition home care, you go into that person's environment, you really get to see how that person is living their everyday life, and you're able to make adjustments to their medication, to bad habits that they can have, eating, everything. I mean, I think that transition care is new to my knowledge, and I can only imagine that it's new to a bunch of other people's, but it is so beneficial. And I love
Absolutely.
how you ladies are working together.
Yes.
Two minds
We're-
are always better than one.
Yes,
Correct.
we're an extension to the doctor's office. We're the eyes and ears, so we really we can report back and to the doctors on things that they're not aware of,
Right.
and also help and make some suggestions. Maybe patient needs food. There's not a lot of food, so we can make recommendations. So we do things like that.
Absolutely.
And one of the things with care management that, being that we're in Florida, we have a lot of elderly that has family in other states. So I know what you're doing is helping, because you can report to the family.
Correct, because our geriatric care managers are considered to be surrogate family members.
Wow.
Meaning that whatever a family member would be able to do if they were here locally, we kind of like with the expertise in care management, knowing what's needed. We assess, we evaluate, we come up with a plan of care, and we make sure that we stick to that plan of care.
Okay.
We can adjust it based on how the person is doing, because ultimately the goal is to make sure that this elderly person is thriving back in
Right.
the community. We want to restore the quality of life.
Wonderful.
And I like the fact that you said earlier today that we're not meeting them in the operating room, because it's a good thing that we are not meeting them there, because what happens after that? What happens when you leave the hospital? You
Right.
don't have your doctors and your nurses with you. what happens? They need support, and that's what we are here for.
So are you in contact with these patients' families back home? So say, I know a lot of people come here from New York or New Jersey or up north in the summer, in the winter, I'm sorry. And they live their life here and sometimes they stay, but a lot of families do stay back. Do you have access to their contact information so you could get a closer look to them?
Definitely, whether they are living here or they are snowbirds, with geriatric care management, the first time we get in contact with a family member, we do what's called a 30-minute complimentary consultation. Why?
Okay.
Because we want to know what's going on with this particular person. What are the problems? What gaps are we looking to fill?
Okay.
So based on that, then I could make some recommendations. This is what we need to do. We take a proactive approach instead of being reactive. We don't wait for things to happen and then everybody's all over the place.
Right.
There may be older adults that have not been in the hospital, but the family is seeing that there has been some type of decline. They've had a couple of falls at home. They haven't broken anything yet. But what happens, we know it's a matter of time until that happens.
Right.
Because they are home alone. Sometimes they are isolated. Family is far away. The ones that are local, they work, they have families, they have young children. Then we could step in at that time. We assess the patient, find out what we can do proactively to make sure it doesn't get to the point of having them go to the hospital and then stepping in at that time.
That's
So
amazing.
that's basically one of the main focus of my company, Premier Concierge Care Management.
Right. So you do you do care to prevent future and reoccurring. I
Correct.
mean, that's so great. And even people that do have family members here, I know it's a time of stress. When you see your parents, your grandparents, aunts, uncles, whoever, kind of deteriorating a little bit and losing their independence, it's a time of stress and it's scary. And it's one of those things that you want to procrastinate until, unfortunately, sometimes it's a little too late and there are injuries. And then it becomes, like you said, very reactive.
Right.
So for the fact that you guys are taking that extra step to ensure these people to feel comfort in their own home, that it doesn't have to be a time of stress and we can all take a deep breath and go on with our lives, but just know that there is somebody there lending a helping hand.
Right. And sometimes even when family members are there, this healthcare system is so complex. People don't know where to go.
Right.
And like Lisa said earlier today, we are the liaison between all the physicians,
Okay.
making sure the specialist knows what medications the primary care physician has the patient on.
Wow.
Because many times we see that there isn't a seamless communication between all the doctors involved in care. That's where care management, home health comes in. Because again, there's a time period between the patient's last appointment, which could be every 3 months if you're healthy, every couple of weeks, depending on what's needed. But a lot can happen
Right.
to an older person who's home alone.
A lot can happen to me when I'm home alone. I mean,
Yeah, and especially after a hospital discharge, we are always, trying to make sure we encourage the patient. That's why we work with Dr. Garcia to make sure that the patient is seeing a doctor within
Right.
the first 7 days.
and I know even after meeting with you, Jackie, Dr. Garcia, everybody, care and comfort and education and the patient is always first. And it's never a question. It's never about the paycheck. It's never about in and out, let's get as many as we can. It's always about the patient. And I think with sitting here every other Monday and bringing on new people and just relating back to your work with Dr. Garcia, it just blows my mind that, you sometimes do become a little dishopeful. What is the word I'm looking for? Whatever you discouraged. Thank you. It's Monday night, everybody. You do
After
become
2 weeks
discouraged.
of,
2 weeks of eating and having fun with everybody. But you do become discouraged. And it's so important for people to just know that there is help. And there are really great people out there
Right.
that still do
Resources.
want to help. Absolutely.
Yes.
And there's locations all over. But I want to know about your location.
Yes. So one thing that I wanted to say about Elite Home Health is that I can say firsthand that they do meet with every single patient that
Right.
you refer to them. They don't wait to make contact once the patient is in the community. Wherever the patient is, either Lisa or Jackie or whoever the representative is, they do make contact with the patient. If the patient is not 100% with it and they have a little bit of, cognitive deficits, they will reach out to family members so that when somebody's coming into the home, they're not just hearing, oh, somebody's here, I don't know who it is.
Right.
They're already expecting who's going to knock on the door and who's coming.
Absolutely,
So that's
yeah.
one of the great things that I definitely like about Elite Home Health. Now, back to my locations, I do serve Broward. I just wanted to get that out there before I forget. I do Broward County, Palm Beach, and also South Miami-Dade. So
Okay.
definitely these are the areas that we service wherever the patient is, whether the patient is at home, they are in a hospital, they are in a skilled nursing facility, wherever they are, we actually go out to the patient because
Wow, okay.
understandably, most of them, not to say 100% of them, cannot come to us.
Right. The
So we go to
transportation is
them.
a big issue.
Correct. Yes.
It's just so amazing how you're just taking into every single element that can be adding on to these people's stresses. And I think it's really just important for everybody to get it. And if you guys are watching this show, please share it out because I bet you that there is somebody out there needing this help, not a little maybe discouraged to ask for the help and whatever it may be. Please call with your questions. We are dying to hear them. We are here for the next 40 minutes.
Yes.
So call at 888-565-1470 and we'll be right back.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects, provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
Welcome back, everybody, to our Monday night show brought to you by Elite Home Health. I am here with Lisa Acosta from Elite Home Health and Ketsia Lavaseur from Premium Concierge Care Management, serving Broward, Palm Beach, and Miami-Dade counties in South Florida. We were just talking a little bit about both of their businesses, their partnership. Of course, again, I'm going to mention if you have any questions, please call in at 888-565-1470 any time of the show. We are here until 8 p.m. and we are eager to hear you guys' comments, questions, concerns. Share out the show, lend a helping hand to those in need. So, Ketsia, I want to talk more about, because now we know who you are, what you do. What are some of the services that you really specialize in, and who can really, really take advantage of your service?
Well, care management is very vast, but at the same time, I do take a personalized approach depending on the client, because when we talk about care management, there is no one size fits all. So it's really the client himself or herself and what they need at that particular time. But some of the things that some of my services include, I do have a Care Management Plus, which is more for patients with chronic conditions. You're talking about patients that have diabetes, heart disease, all of these patients, high blood pressure. We understand that it's very difficult for them to manage at home.
Right.
And again, we do have home health coming in. They are assisting with the medication management. we are making sure that they are actually taking the medications the way that
Okay.
they should be taking them.
Great.
Because what happens if they don't, they become non-compliant, then things happen. They go back to the hospital.
Yep.
We also have our transitional care management, which is kind of like similar to what Lisa was talking about earlier today as far as what Elite has. But when the patient is at home, there comes a time where although we want to keep them in their own home because
Right.
that's where they do better, but there are times where they do have to move into a more appropriate level of care. And
Yep.
we are talking about assisted living. We are talking about independent living. So basically, me being in the home and in the community, I do a monthly assessment. Depending
Okay.
on what's going on with the patient, I do a weekly visit. If there's no need to do a weekly visit, I do call them once a week because now we are
Wow.
planning for the future. And we talk to the family about recommendations. We feel that based on how they doing great, but let's prepare. If
Right.
something were to happen, are we going to have that person move into an assisted living facility where they do have some type of medical oversight at the facility,
Right.
but yet they do get a chance to socialize with other people. So they're not
Absolutely.
isolated. They are not at home alone. So this is my the transitional care program where we are able to actually make sure the patient goes to the appropriate level of care at the appropriate time.
That's
so these are
incredible.
the first two services.
And that's even just leading back to our previous comment. You do prevention for future falls, future injuries, whatever it may be, and reoccurring. So even if the patient is back to 110% and they're really doing everything almost perfectly the way that they were before, it's still important to, we can't rule out every possibility. You never know what life is going to throw your way, and it's better to be over prepared than under. And I think that, Ketsia, you really do a great job with providing comfort to these families because it is a time of stress. It is a time that nobody ever thinks about in their life. You plan out your whole life, you don't think about this.
Right.
But it's okay. It's a reality. And
Right.
it's easy to be done. And it's 1, 2, 3 and a huge peace of mind.
Correct.
I just think that that's so amazing.
And as you mentioned, it's like having that support in the community.
Right.
Knowing that if you're not feeling well, my blood pressure is a little bit elevated today. What do? Am I going to call 911 or I'm going to call my care manager?
Your care manager.
You call your care manager.
Absolutely.
We are preventing the patient from going back to the hospital unless it's truly necessary. Then the blood pressure is a little bit elevated. Let's call the ordering physician. Let's call the primary typically.
Okay.
Are we adjusting it? Are you calling in a new prescription? What are we doing? Because this is the situation, because we also help the physicians, the primary care physicians, to provide better care for their patients
Right.
in the community. Because again, we see that without that level of support, because all it takes is one fall.
Yep.
One time that the patient goes to the hospital, then every little thing, this is what they are becoming accustomed to, picking up the phone and calling 911. Sometimes it's not necessary. And what do we see with that? The more you are back and forth into the hospital, the more of a decline that we are starting to see.
Right.
Because you're not thriving in your own environment. You are not at home. You are back and forth. And a lot of people, sometimes it gets to the point where they are so scared of being at home because they don't know what's going to happen.
Right. It's like this fear you kind of build up in your own head because, there are a lot of elderly people that are living alone, and even some that aren't, and they're still happily married or whatever the case is.
Right.
Their partner is reaching
Right.
the same level. And it's
Right.
difficult. I know from personal experience, my whole family was looking into this. And I think it's so great because, you would never know that I could refer it to somebody. So you, as the viewers, never know who you can refer it to.
And this is how we work together. As
Right.
you mentioned, perhaps it's a situation where a hospital's stay is not needed or
Yep.
or having the patient go to the hospital, but maybe that's where we can step in
Absolutely.
and have one of our registered nurses or therapy, whatever's needed.
So now I have a question about that because when it comes to hospital, people think, even though it's not always the case, people think, all right, quick, immediate care because it's an emergency. if somebody calls you, for example, like you brought up with the elevated blood pressure, how do you go about that? Do you have people on call that can make a home visit right away? Do you send them somewhere?
This is what I also have as part of my services. I have a concierge companion service.
Okay.
So what that does is that there is a private duty aide in the home with the patient. So
Okay.
there are times that people don't need a lot of physical help, but they do need somebody to provide a little bit of supervision.
Right.
So from the initial assessment, we kind of like see what the needs are and what to expect, because there would not be any type of surprises, because if the blood pressure is being monitored on a daily basis, we jot down what it is from time to time before you take the medication, after you take it. So unless it's something out of the norm, it should be something that we can kind of like foresee coming in. So let's say that this morning the patient wakes up, they take the blood pressure, it's really elevated. We're not talking 200 over 150. We're talking about like a little bit higher than normal.
Right.
Then that's when we put in the call to the primary care physician.
Okay.
We let them know this is what's going on, because again, if the patient is seeing their doctors on a regular basis, they're not going to have an issue with calling in a different prescription.
Absolutely.
And we make sure that they are compliant with their doctor's appointments. They are taking their medications. So anything that happens, we can call that office and make sure that they are being seen. And sometimes with the transitional care that I know Elite Home Health has, you can FaceTime a physician.
Right.
Their doctor, you can FaceTime them.
Absolutely. That was something that we talked about. And I even talked to the doctor after the show, and I said, I want to know how to do this for myself, because I moved here not too long ago. And just like anybody, you know, you're in a new environment, or you're in the same environment that you've been in for forever, and you feel like, oh, well, I would know what I would have to do. God forbid something happens.
Right.
But that's not the case.
Right.
And like I just keep stressing, it's so much better to be over prepared than under.
Yes.
And so now, say that somebody's heart rate is very elevated and they have to make a trip to the hospital. Their primary care is saying that. Does the care provider that they're assigned to with assist them to the hospital and sit there with them? How does that work?
We are open 24/7 for emergencies such as this one.
Okay.
I want my patients to call me regardless of what time it is, after they've called 911 and they find that it's appropriate for them to go to the hospital. I want to know if it's 10 o'clock at night, I want to know which hospital you're going to, because first thing in the morning, I'll be there. Why am I going to be there? I want to make sure that I communicate with the physicians. I use a very good electronic medical record system that does have all my patients, their pharmacies, their medications, because it's important to make sure that when you go to the emergency room, you know what this particular patient is taking. You know what their allergies are. Are they allergic to any medication? Because we're talking about an elderly person who's probably confused, and they present to the emergency room, there's no local family there, they don't know what to do. So that is why we want to make sure that as soon as we are able to get to the hospital, we go ahead and do that and provide the necessary information and medical records that's needed.
It's incredible. You're just surprising me with more and more. That was something that I talked to another healthcare provider about the last show that I did. Elite Home Health educates and supports, and what you're doing is educating and supporting.
Correct.
And that's why I'm thinking you guys are such a great partner together, because, you know, you do show up to the hospital despite the time of the day, despite the time of the night you're getting these phone calls. That right there is a security blanket over that person.
Correct.
Whether they have family here or not, you become like their family. And we were talking to one of the doctors, I forget his name, but he was saying that a lot of patients do come in and they give them just a list of the medications they're taking. And they say, okay, well, why are you on this? I don't know.
Right.
And it's just more security to know that your grandparent, your mom, your dad, your aunt, uncle, whoever it may be, is going to be in good hands until the day they don't need the hands anymore. You know, I mean, it's
correct.
You can never just turn an eye, and I think it's incredible.
Yes, and I find that now a lot of the physicians are a little bit more open to care management, because it's sad to say that, especially when it comes to the elderly population, Medicare is paying you to care for a patient. If they will want to know, why is this patient being readmitted every 30 days for the
Okay.
same diagnosis? What is the problem?
Right.
How do we fix that? So that's where Premier Concierge Care Management comes in, because we keep that open communication with the physicians. We monitor the patient. We keep an eye on them.
Right.
We make sure that they have the supportive services in the community. If they need a home health aide to make sure that when they are taking a shower, they're not falling, we make sure that's provided. If they need someone to prepare their meals, we make sure that's done. We even encourage our caregivers to basically go out with the patient.
Wow.
Give them a little bit of quality of life, which is one of my services also, as you can
so
see in the
amazing.
brochure,
Right.
with the quality of life care management, because a lot of them are still able to walk around.
Right.
They're not confined to a bed or a wheelchair. They do want to enjoy life.
Right.
So let's do the best that we can to make sure that's happening.
And that's another big thing, I think, with people that I've seen and people that I've come to know that are of the elderly population, they don't want to ask for help because they don't want their independent rights taken away.
Right.
So, and that's a big thing. They think right away when you think, oh, okay, I need help. It's, oh my gosh, I'm going to be on bed rest for the rest of my life
Right.
with a bunch of medications. And the fact, I just want to go back, you said that you can help prepare meals. I think that is one of the strongest things that you've said, besides the quality of life and everything else, because a lot of these people, you know, anybody, you know, you're tired, you make a bowl of cereal for dinner, you call it a night, but it becomes a habit. They can't really use the stove as much. They're not able to access everything that they used to be. So they're not getting their nutrition, and they're taking medication that requires a decent meal
Right.
to get better.
Correct.
So it's all about getting down to the root of the issue and not just dealing with the symptoms. You know, if you're
Right.
nauseous, it's not just, okay, well, take this and just go to bed. You'll wake up and feel better. It's
Right.
about, okay, well, what did you eat today? How are you feeling? Let's check your blood pressure. Did you get a lot of sleep last night? Let's
Right.
drink some water. And with the quality of life, I think that, you know, just being outside totally improves anybody's mood.
Right.
It's the sun, it's Florida, it's beautiful. I mean,
Yes.
everybody loves it. And that's
Correct.
why a lot of these people do come down here.
Right.
So I think that's so great. So when somebody is really able to move around, or even if somebody is in a wheelchair, but they still want to go out and enjoy their life, how do you deal with that?
Because again, we go back to the concierge companion
Great.
service. I do work with many great agencies in the community to make sure that I'm able to match my patient with the appropriate person. Because
Right.
again, we are not just going to have someone go to the home because they need supervision.
Yep.
We have to make sure that they get along, they understand the patient. Because again, for somebody who's in their 80s, they don't want someone coming into their home to tell them what to do.
Right.
And we have to make sure that there's a match there to make
Yes.
sure that caregiver knows what the patient preferences are and they are willing to work with that.
Right.
So having that caregiver in the home, many of them, they are able to drive patients to appointments, to doctor's appointments. The care manager is able to meet them at their doctor's appointment to make sure that, again, this is where the medical records come in. The patient may have been in the hospital. Cardiology started them on a new medication,
Right.
but do we know whether or not the primary care physician? No, we don't know that. So they take them to the appointments. The care manager meet them at the appointment. They go over everything. So
Yeah.
the concierge companion program is great because again, we don't have a care manager in the home 24/7.
Right.
We have it to make sure that services are being provided, the plan of care is being implemented. But again, we supervise those caregivers, make sure that they know what to do, how to do it, and make sure
That's
it's being
great.
done well.
That's great. It's all about boundaries and finding that mutual respect where both the patient and the caregiver can get along and make it work. And because it's not just about, okay, go in and do your job and then you could go and you could go out
Right.
to eat with your family. You know, it's
Right.
about go in, do your job, get to know the person, create a connection, and make them feel comforted, and comfort yourself too. And that's why I think that you guys love your job so much, because you take yourselves into consideration, and all of your employees do too, because you're around these people and you have to be people to do what you do. It's not like you're just hiring anybody off the street who has no
Right.
patience. You want to be there.
Right.
And you're not belittling anybody,
No,
you know.
I think of my parents.
right,
Yes.
right.
I mean, I think of every case. This could be my parent. What would I do?
Right.
Absolutely.
And that's it.
That
I
was a
mean,
big
that's
lesson that
key.
I learned about an ambulance driving on the street. My mom always said, "Well, if it was your parents, what would you want?" And I said to turn over. And automatically, you know, now I'm living on my own, and I'm seeing my parents get a little older, my grandparents, and any elderly person or any child or anybody that, you know, isn't as mobile as they used to be.
right.
You have to step in, because they're a person and they are a piece of somebody's family.
Yes. And what I say is that not all of us will be blessed enough to get to our 80s.
Yes.
Because when you really look at it, people are dying younger and younger. So for me, it's a privilege, like, to be able to help this person, because I don't know that I'll get to where they are in life. I don't know that I'll get to experience what they've done in their
Right.
lives.
And honestly,
So-
the wisdom that they all hold.
Yes.
I mean, everybody used to laugh, but you sit down with someone that's over 60, and it's like you went to school for 10 years in one day. I mean, you
Exactly.
learn about everything, and it's just really all about respect and creating the connections and enjoying yourself while doing it.
Correct.
It's not a job, it's a lifestyle. And we're here to impact your lifestyle in a beneficial way. And if you do have any questions, please feel free to call in at 888-565-1470. Share out the show, like, comment, tell me anything that you want to hear. I would love to ask these lovely ladies anything, because they are so good at what they do. They got me before I ask it. We're going to take a quick commercial break, but before that, Ketsia, how can I reach you?
Our contact number is 954-446-7022. So call us for a complimentary consultation. Call us if you have any questions. Call us if you want to know what's available in the community. Call us for anything. There is no silly question, and we understand that the healthcare system out there is very complex, and even the best of us, sometimes we have to step back a little bit and say, okay, hold on, I think I know the answer to this, but let
Yeah.
me double check. So
It's always good to just have somebody to just tell you an answer, or to be like, you know what, let me come in and help you. Don't worry about anything. I will answer everything.
Correct.
We'll be right back, guys, and call in with your questions.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects. Provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
Welcome back to the show, everybody. I just took a water break because you know what? You need to drink and hydrate and stay healthy so that you can make it to your 80s.
Yes.
Anyway, Ketsia, we were talking a lot about how you deal with families, and first of all, that's really awesome, and how you have contact and open contact. However, with these snowbirds coming down, if their families are back home and they're really concerned about their families coming down here, how do you address that? We did get a question, and they said if my mom is in New York City and if I'm in New York City, sorry. If I'm in New York City and my mom falls down here, how will you be able to handle it?
So basically, whatever you would be here to do, we'll do a much better job because we have the expertise in care management. So basically, what we do is that instead of you trying to request time off from work, purchase a plane ticket last minute, which costs you so much money, you come down here, you don't know how long this episode is going to last. Premier Concierge Care Management goes in, they see your loved one in the in the hospital. We complete our assessment. We keep in contact with you. And speaking of that, my electronic medical records, I basically can give access to family members that are out of state where they could go. It's similar to like a Facebook page where you go in,
Oh, great.
you see doctor's appointments, you see what happens, you see the case notes. So basically, even if you come home, let's say at 10 o'clock, you're like, oh, she's probably not taking calls now. I wonder how my mom did today. You can basically go into the care management
Wow.
software and you'll be able to have an update on how your family's doing. So basically, sometimes we make recommendations for family members to come in and visit, but we make sure that the patient is in a stable environment.
Right.
Let's say that they've already transitioned from the hospital to home. Now the family can come in and visit the patient and be able to spend more time with them.
That's great,
Versus
yep.
coming in and trying to put all the services, all the care together. You leave it to us. We get it done. We communicate with you. We let you know how mom or dad is doing. And we get them home and we make sure that we start working on preventative measures.
That's
to make sure that
incredible.
that fall is not incurring again.
Yeah.
And I think one of the things that we were talking about while we were on commercial break was about some of the progressive diagnoses,
Yes.
such as congestive heart failure. We
Yep.
have dementia. We have COPD. So all of these, we can kind of like take a more proactive approach because we know that these are progressive.
Right.
So we are hoping that we are able to manage them, not get them better. Because again, if it's not being managed, it's declining more rapidly.
Yep.
So these are some of the things that Lisa and I were talking about where we are able to make sure that we get all of that done.
Absolutely. So when somebody calls you and they say, I think that my dad is having symptoms of dementia or maybe even Alzheimer's, I don't know what to do, can you pay them a visit?
Sure.
So when you go and you pay them a visit and everything seems fine and the person is definitely showing symptoms, but they're not really sure about this home health care.
Right.
How are you going to comfort them and just let them know that it's not anything to be ashamed of?
One of my services, again, if you look, is the geriatric assessment.
Right.
What does it do? It assesses the person's physical environment, the medical status, and more importantly, cognitive.
Okay.
Because again, we know that people get forgetful. I mean, after a full day of work, I don't even know what I did like 30 minutes ago.
Yeah.
But then sometimes the families are concerned because they call the older adult and they kind of like getting different stories that are not making
Right.
sense. So with the geriatric assessment, I complete the assessment. I go over all the different aspects of care. Then I let them know what my findings were. And based on that, we create a plan of care based on where the patient is. Do we feel that based on how they're doing, they can be at home with a caregiver for a few hours? If that's the case, let's work on that. Do we feel that based on how they are, there's no way that they can survive at home? Let's look into an assisted living facility for them. So depending on what the outcome of the assessment is, that's how we make the determination and we make the recommendation for the most appropriate level of care.
And again, in a time of stress, you guys are providing the holding hand, and you
Correct.
are doing all the work that nobody really wants to do, and just to provide comfort for not only your patient, but for the patient's family.
Yes, definitely. Families, they want that peace of mind.
Yeah.
They want to be able to sleep at night knowing that there's somebody there keeping an eye on my mom or my dad.
And they want more time with mom and dad, you know, really being mom and dad, and really, even if it came down to it, them asking them to cook something, you know, just to
Yes.
make them feel
Yes.
like you're still my mom, you're still my
Yes.
dad, and it's okay.
Yes, and like you said, we talk about the family members that are in New York.
Yep.
Even the family members that are here in Florida, they don't want to be the care coordinator.
Yep.
They don't want to be the nurse. They don't want to be, they want to be involved. They want to know what's going on. But then they work, they have their own children. The time
Right.
that they have to spend with their mom or dad should be a time, like you said, where they can have fun, they can still enjoy each other's company as a family, and not necessarily connecting the dots.
Right.
And this is where Premier Concierge Care Management comes in.
That's
It can
so
be overwhelming.
It
for
is so
family members.
overwhelming. And you know,
All
it's
the
just
different
the thought.
medication
Yep.
and a new diagnosis, like you said, diagnosing dementia or
Right.
Alzheimer's, seeing the signs and then diagnosing it. It's overwhelming. And also the family, it's and the patient having to deal with something new like that.
And even just like a typical person without a medical background, you don't know the medications that your family is taking.
Right.
You are not aware of what this medication is doing in correlation with this medication. And a lot of people, this is why I'm so surprised that education is a big part of your practice. Not surprised, just happy to hear. Because, I don't know what I don't know. And you just don't know what you don't know. And it's okay. And you don't have to. That's where you guys come in. And it's difficult for a family member to visit mom and dad and to look at the pill calendar or whatever they have separating their pills and
Right.
say, Mom, why are you taking 5 pills in a day?
Right.
Oh, don't worry about it. The doctor that we've all gone to totally recommended it. But what is it for? Oh, something with my whatever, something with my heart. Because it's overwhelming. Nobody wants to sit down and say, okay, so I had a new diagnosis I didn't want to tell you about because I'm managing it. You're holding their hand, you're doing the dirty work, you're doing everything to avoid the stress.
Right.
So that everybody can enjoy mom and dad and grandma, grandpa.
And one of the things we do too, we work in collaboration with the patient and the family.
Okay.
Because again, we make the recommendations
Right.
and we work with them. We make sure that they understand, we monitor the patient, we give them updates on what's going on. It's a collaboration, just like Lisa and I, we are collaborating,
Yeah.
Premier Concierge and Elite Home Health, we are collaborating. We are making sure that everybody's on the same page because we understand that if one link is missing, something is not going to work well. So we make sure that
Absolutely.
everybody's on the same page and it's seamless care, making sure that everything is being provided in an appropriate manner and making sure that the patient remains in the community and they are well.
And I think that that's also really beneficial for the patient because a lot of the times patients think, oh, well, someone's taking care of the work no one wants to, and my family's kind of involved, but where do I come in?
Right.
And how am I going to really know? Because, it's your family wants to protect you and they want to shelter you just like they did to you when you were a kid.
Yes, yes.
But, it's very important for them to realize that they still have a voice, they still have an input, and they still have a right to their independence and education. They're still a person.
Correct.
You just need help,
Yes.
and that's okay.
Yes.
And it's better to ask for help before it's too late.
Correct.
And I think that just provides comfort to anybody,
Yes,
But
I agree.
so when you deal with elderly people that do have families living here, say there's a big family gathering. And so, for example, the holidays just passed and maybe Thanksgiving, Hanukkah, Christmas, whatever it was. And there's a big dinner and someone's mom or dad is getting a little overwhelmed and they do have your caregiving services. Are you open to maybe assisting them during the difficult holidays and just to give them a peace of mind, make sure they're not killing themselves by overworking themselves in the kitchen or something, trying to just do what they used to do?
Yes, definitely. Our role in the community is to show that we can put together supportive services to make sure that it's not too overwhelming on the family
Right.
and it's not too overwhelming on the patient. Because, of course, we work with the patient and the family. We are not going to recommend a service that we feel is not needed. And there are times where some family members would feel a little bit more comfortable having someone there around the clock.
Right.
That's always better than not having someone at all. So we do take everything into consideration, whether it's a natural disaster, whether or not they have questions about anything that they may feel is going to become an issue in the future. We do take the time to complete assessment because, again, assessment, that's the key. Without an assessment, you don't know what the problems are. And there's no way of fixing something if you don't know what the problem is. So
Right.
we definitely continue to assess the patient. We work with the family. I even have one of my programs that's like the caregiver assessment.
Yes.
Because as you mentioned, there may be a daughter who's there taking care of the patient, that's great. But we know that caregiver burnout is like one of the leading causes of decline in the caregiver and
Wow.
also in the older adult. Because think about it, you don't go out, you don't do anything for yourself. All you do, you take care of mom 24/7. That's your job because you
my
love
God.
her. But sometimes the care manager will come in and say, you need some respite. Let's get a caregiver here with mom, and you can go out and go get your hair done. Go to the
Right.
restaurant, go out to eat. So
Just take a breather.
correct.
Now, with that, I know a lot of elderly people do enjoy going out to eat. Do you assist them in going out to eat if that's something that they want to do? You know, keep their normal life as much as they can.
Correct. So the caregivers that we match the patient with is going to provide whatever services
Oh,
they
great.
need. If they
Awesome.
if they are able to leave the home and go get their hair done once a week,
So
They
great.
take them to doctor's appointment, whatever it is that they need. Because again, one of the things that we make sure we know is what the patient used to do, what their hobbies are.
Right.
Because sometimes even a modified version of what they used to do brings them joy.
Right.
How do we make sure we have that included in the plan of care?
And I see a lot of, for example, even in my family, you know, they start to lose hope and they start to get discouraged and feel aggravated
They
at,
get redrawn to themselves.
Absolutely. And I think that a positive attitude is the cure to a lot of things. And you're going to see yourself moving better and doing better with the positive attitude, other than sitting on the couch and thinking, well, you know, I don't know what is going to happen. I lived a long life. I don't feel good. This is going to be the rest of it. It doesn't have to be.
Right.
And you provide happiness and joy and the little things that maybe they're not capable of remembering how much they loved, and it just takes a little push.
Right.
Just a helping hand.
Correct.
So now, say you obviously you're going to make a connection with the patient no matter what. You make a really great connection with the patient. They have to go into a nursing home. Do you keep in contact with them, or do you leave it up to the nursing home now?
Well, because again, based on what's going on with the patient, we would prefer that we still go in and visit that patient. Because like you said, once you have that connection, that person is comfortable with you, you want to continue to monitor them. You know, depending on why the recommendation for nursing home comes in, are we talking about short-term nursing home or are we talking about long-term? Even if it came to the point where they have to go into a nursing home long-term, this is their home. This is where they live now.
Right.
Care management services do not have to stop.
Right.
Because again, we are there to provide that supportive aspect of the person life. We come in, we see them, we check with the nursing home staff, we find out how are they doing.
Yes.
You know, having that same connection, having that person advocating for the patient,
Yes.
it's super important. It's very crucial having that, making sure that they know that, oh my God, the patient's care manager is coming in. Today is Thursday. They come every Thursday. You better believe that everything will be great.
Right.
Like it's going
something
to
to
be
look
great.
forward to.
Exactly. So these are things that we still continue to do. And again, we assess and reassess, we evaluate services. We make sure that no plan of care is set in stone because it's really based on how the patient is doing.
And also, like you said earlier on in the show, is you're not in competition with these pediatric care. You're not in competition with any of the doctors that these people are dealing with, especially with nursing home. And the nurses that they do have there, you let them do their job and you guys want to work together.
Yes.
It's not one-upping. It's not the tug of war of the patient. And it's not making the patient uncomfortable.
Right.
It's providing as much care, as much education, and as much support as your loved one truly, truly needs. And
Correct.
there really is never enough.
No.
You know, you can never feel too loved, you know,
and we are the advocate for the patient. We are the support system for them. We make sure that, you know, their well-being is first. We promote, we reduce hospitalization. We promote overall well-being. We reduce isolation. So all of our services are really focused on making sure that for as long as they are around, they do have that quality of life. They do have something to look forward to. Knowing that, oh my God, I haven't been to the hospital
Yeah.
in 3 months. My symptoms and my diagnosis are being managed and there's no need for me to be back and forth in the hospital. truly believe that their quality of life will be much better because, as we know, the better we look, the better we feel about ourselves. We can see the older person perk up because guess what? I'm not back and forth in the hospital. I'm able to stay at home. Yesterday, I was able to take 10 steps with my walker, but today I'm walking 50. So these are the things that we see.
Absolutely. And even when you have a walker and everything, like you said, sometimes you're going to take 10 steps and sometimes the next day you're only going to take 5 steps. But it doesn't matter because you're up and you're giving it a go and you're dealing with it with a helping hand.
Correct.
I think that this show was insanely informative. I think that you two ladies are a great asset to this Medicare system and the medical system in general. And you guys are great healthcare providers.
Thank you.
I love doing the show and learning more and more about it. And I hope that the viewers do too. If you guys like the show tonight, please share it out. Be kind, and share it out. How can I reach you?
And definitely it's 954-446-7022. We do a 30-minute complimentary consultation. We are able to answer any questions that you may have regarding your loved one, a friend of a friend, whoever it is, whether it's local or out of the state of Florida. We are able to give you any information and resources.
And Lisa, how do I reach you at Elite Home Health?
So depending on what county,
Yep.
Broward County phone number is 954-267-9029, Palm Beach 561-509-5800, and Martin, St. Lucie 772-214-3300.
Do either of you ladies have a website that anybody can visit if they have any questions?
Yes, it's www.premierconciergecm.net.
Wonderful. And of course, and if any of you viewers do have any questions, please leave a comment down below and we'll be sure to answer you guys. We are here to help the community as one because we're not in competition and we are partners in all of this thing called life. Well, thank you guys so much for tuning in. My name is Jackie Birch. This is
Ketsia Levasseur
and
Lisa Acosta
with Elite Home Health. Thank you guys so much for supporting Elite Home Health and get your care in order.
Thank you for listening to the Elite Home Healthcare Show. Elite Home Healthcare delivers care to you or your loved one in the familiar comfort of your own home. Medicare pays 100% of the costs with no copayment and no deductible for qualified homebound patients. Elite Home Health Services will develop an individualized plan of care to meet your specific needs. Skilled registered nurses and physical therapists will plan and implement your care, along with your participation and your doctor's guidance, assuring a plan specific to your needs. We'll make multiple visits to your home over weeks or months to make sure you are recovering according to plan. For more information, call us 888-422-3578. Join us for more information and news. 95.3 FM, 96.9 FM, 103.9 FM, and AM 4.